You hear the word cancer, and you want answers now. For the newly opened OSF Cancer Institute, a rapid intake system was developed to address just that.
It's really special, and the patients feel very supported, and they feel like, oh my gosh, it started. The journey now has started. I have this person that I've spoken to. I've told them all the things I need to tell them, and they're going to take it from there.
That's Mandy Lakowiak, manager of OSF On-Call over the Cancer Institute Intake and Patient Navigator teams, and I'm Shelley Dankoff, your host for OSF Healthcare Accelerated. We appreciate you tuning in and remind you to be sure to subscribe, rate, and review wherever you get your podcast. The state-of-the-art OSF Cancer Institute opened earlier this year. Located in Peoria, Illinois, it's the main hub of an integrated cancer network across OSF healthcare, with patients receiving care near home when possible. With the capacity to treat nearly 4,000 cancer patients each year, it is important that each of them gets started on their diagnostic and treatment journey as quickly as possible, because when it comes to cancer, no one wants to waste time. So we developed a rapid intake system at the OSF Cancer Institute. Joining me to discuss this innovative approach to cancer care are Mandy Lakowiak, manager at OSF On-Call over the Cancer Institute Intake and Patient Navigator teams, and Sarah Ince, director of Contact Center Operations for OSF On-Call. Welcome to you both. Sarah, I am going to start with you. Let's go back a little bit of time. You don't just go, hey, let's open a rapid intake system. This process took time to develop. So walk me through the why it was developed and the goal.
Sure, and thanks for having us here today. We really worked with all of our teams across the ministry, working collaboratively to put together this rapid intake model, really with the help of PI, Performance Improvement, leading the way with leaders across the ministry with our Cancer Institute, oncology leadership, revenue cycle, on-call, and many in between. So really thinking about how could we get patients to us quickly. Started with benchmarking with other organizations across the country, the best of the best cancer institutes. And we learned a lot. We partnered with them. We were able to look at their intake model, how quickly they got back to patients. And we really modeled our own after some of the best in the country. So we're able to get patients to us quickly. That really starts with the self-referral. Patients who may not know what to do, they're seeking care, they're confused, they're anxious, they've maybe just received a cancer diagnosis. So being able to get our patients to us quickly and effectively, so being able to give them different means, a portal, a phone call, really that one centered phone number to get to us, to allow patients to get where they need.
And stay tuned. We are going to give you that phone number later on if you are that person, because it's not just, I think back in the old days, you had to go to your doctor and they delivered this not great news that nobody wants to get that with the C word in it. And then you had to go through a referral process. Well, now people can just call up and self-refer or at least ask questions, because we all know the internet is full of crazy, scary things, and you need to go to somebody who can talk you through it. Is that some of the goal of this, is to calm some of those fears?
Yeah, and to be available whenever they need us. So being able to outreach back to patients if they leave an email inquiry is really, our goal, so that they don't have to wait if they're waiting to get into their primary care. Maybe they were seen in an emergency room, received some, troublesome news, then they can outreach to us and we will connect with the reports from the ER. We'll connect with their primary care, maybe a specialist they've seen, to get those next steps moving forward.
And sometimes you just need to hear that other reassuring voice, I think, as well. So Mandy, when you're over this team, we hear rapid. Rapid to me is like, okay, that. Is it like that, or walk me through the specific process?
It really is pretty much like that. As Sarah said, we get intakes in many forms. The patients can do it self-referral on a portal. They can call us directly. We also receive referrals via fax from providers. So there's a multi-entity approach to getting access to us. And so really, once that phone call or referral hits our team, it is like that. Our team works very quickly to access all records, all reports, any visit, any treatment that this patient has had. And within really 24 hours, one business day, they have an appointment with our nurse. And so they have a visit that they do virtually over the phone with our nurse, and we go through their entire journey. It's really a dedicated appointment for them to tell us your story, tell us what's happened, tell us what you want, tell us where you want to go with this, and then we take it from there. We reach out to the providers that are needed. We seek all of the records. We really take that time to package a resource for the provider so that they have everything they need in a one-stop shop for that patient.
So these are advanced practice providers too, because sometimes you hear this and you're like, okay, I'm going to self-refer. And it's kind of like that form you fill out on the website for stuff and you don't know where it drops off or what administrative assistant is looking at it. But these are people who are highly trained. They have a medical background, so they can, ask the questions, correct?
Yes. All members of our team have a background in cancer services. So we have 2 advocates that really do a lot of work to get all of those records. They have extensive background in cancer services in our area. And so they spend the bulk of their time really prepping all of that journey. And then our nurses are similar. They have a history in cancer services here in our community and have been doing it for a very long time. And so they know the questions to ask. They know the providers that are local. They know the resources available to help guide not only the conversation, but then the next steps for the patient.
So when we built this team, we really partnered with the Cancer Institute leadership to make sure we were hiring the right team with the right experience. They went on site to the Cancer Institute and to the oncology services to train directly with the cancer navigator so that they could be a team. They're together. They partner through this.
Yeah, let's touch a little bit about the navigators because it isn't, okay, so you come in through this rapid intake. I've set up, and early on, and if you've ever been through a cancer journey, there's initial stuff that just gets thrown at you. But you want answers. So I think people are okay with that because you're just asking a lot and learning a lot. But it can be overwhelming. So that's kind of where the navigators help keep on track, don't they? There's a lot of coordination that goes into this stuff, isn't there?
Yes, absolutely. The nursing team that is in the cancer intake portion of this, they are not technically navigators. What they do is they set it up for the navigator. So then that navigation piece, they have that journey ready. They have all of that imaging, all the treatment that they have historically had. Or maybe it's none. Maybe this is the first diagnosis. They don't even have a diagnosis yet. They got a report on a Saturday afternoon after being at an ED visit, and they call us. And so then it starts that journey for the nurse navigator to then really be at the elbow with that patient throughout the rest of the process.
I imagine you get a lot of calls or voicemails that say, I didn't know where else to go or where to start. Is that a common thing that you hear?
It is. That is a very common thing we hear from the patients, but also I'm so excited that I got to talk to a real person. I'm excited that I got to talk to a nurse today. That is feedback we receive on the daily.
And sometimes they're waiting for their referral. So maybe their primary care put a referral in, but they're reaching out because they just want to know where it's at and have that reassurance. And our nurse coordinators, our intake coordinators, can really connect that patient with this reassurance, check in on that referral, and then also reach out to the support services cancer navigators.
Sometimes, like you said, you need to know who to push and how to push, right?
Yeah.
It works both ways. So what are you hearing from, well, let's start with providers. The providers who are connected through this, because they're busy, their office staff is busy, there's a lot going on in their world. Oftentimes, if it is a primary care, they're not just solely focused on cancer care. So there's a lot of stuff happening. So what are providers saying?
The providers are really excited. They feel like this is the most comprehensive chart for that patient. They're getting all of the information across the country. This is not just local. So if we have a patient that, they are in Florida X amount of months a year, they might have had imaging done there. They might have had a treatment there. We're gathering all of that information. And so the providers are really excited that the first time they see that patient, that first visit, everything's there. They then don't have to step out of the room and say, oh, I heard they have imaging in Florida. I heard they, had a treatment at Mayo's. Can we get those records? Because we've already done it. So the visit is incredibly comprehensive. So they're excited. They're excited to have that.
So for our referring providers, that's part of our roadmap and future growth is to really look at this in a phased approach. This is our first focus is self-referral, but being able to expand into our external PCPs and maybe specialists, and then even beyond to our internal to make it easy, simple, and seamless for our internal resources.
Okay, what about the patients? I mean, I've gotten bits and pieces here, but broadly, what do you hear from patients?
They love it. They really do. They instantly make a connection with our advocates, of course, but with the nurse. I've been in healthcare a long time, and it's really wonderful to see in such a short amount of time and just over the phone. It's not even in person that they've instantly made a connection with that person, and they will call back and ask for them. Can I talk to so-and-so today? It's really special, and the patients feel very supported, and they feel like, oh my gosh, it started. The journey now has started. I have this person that I've spoken to. I've told them all the things I need to tell them, and they're going to take it from there.
Yeah, that's special.
Very positive.
So we're only about 5 months into this. After all, how long did it take to develop? I mean, you spent years.
Years, and really on call about a year out became a part of that team, and really, thankful to our leadership team from the Cancer Institute, from our performance improvement, really looking at us as that specialist, that we specialize in intake, we specialize in patient navigation. So having this collaborative team look at how can we do this the best that we can, and having us at the table really helped us design. So I would say about a year, we started that patient navigation, cancer intake design.
So we're about 5 months into it now from when the Cancer Institute opened. Number one, is it working the way you hoped? And what takeaways are you getting, and maybe some tweaks are you making along the way?
So Mandy came on our team right before I think we went live.
Yeah,
right?
I think
in
2
January?
weeks.
Yeah.
2 weeks before it went live.
So, having her come in and help really open this up and drive it was so beneficial. Mandy has a ton of leadership experience. She's really brought a lot of energy to this team. I would say that we've had some hiccups. We've had to pivot on maybe some of the design or Epic charting, things like that. How do we get referrals? Because, we're doing the work, but how do we connect with external providers to get that more seamlessly? And really, Mandy's been working so closely with our nurses and our advocates to make it an easiest possible experience for all.
I appreciate that honesty, because anybody who walks in and says, we developed this system, we launched it day one, it was perfect, is not being fully truthful, because I don't think any system is going to work perfect out the gate. But it does sound like it's about 99% wonderful.
Yeah, I mean, 99 might even be stretching a little bit, to be honest. But, IT is always going to be an issue. When you open a new project, when you have a brand new team that's never existed, the department number is brand new, everything's new. And so the IT piece of it is always going to be a little bit of a challenge, and you're going to find things as you go. Oh, yes, we need to tweak that a little bit. Oh, yeah, that needs to change. But the vision of the process, the vision of why this was implemented is 100% successful. What we need to do for the patients to get them quickly in the door at Cancer Institute is successful.
So this is focused, this is specific to the Cancer Institute. Do you see this potentially working in other areas? Are the thought bubbles going, oh, we need to do this for, I don't know, neuro, cardiology, something else? Are there thoughts of expanding this into other areas?
Yeah, we definitely are already having those talks and really looking at opportunities. And we've had different members, throughout our organization say we could really benefit from a centralized intake, rapid intake for different services. So we have been already looking at, discussing and looking at different designs. And I would just say this all would not be possible without that collaborative approach. Our IT analysts, yes, the IT issues may be there, but our IT analysts, our nursing informatics, our education team, internal at On-Call, and with IOL make this all possible. It's just an amazing group working together to get through those, pivots.
Yeah.
Okay, so before we wrap up, because I hear the passion from both of you, I see the smiles on your face. So I'll ask each of you this question. Is this what drives your passion? Is this what gets you in the door every day and you just go, okay, this is wonderful. I see the passion. Is that it?
Yeah, it comes from a personal experience for me. My dad has stage 4 kidney cancer that's metastasized in a patient in the community. And this is just what I needed a few years ago. So I really feel connected to this journey through my diagnostic imaging scheduling with that journey, and then to now Cancer Institute. I feel blessed to be in part of this role.
Yeah, I don't have necessarily one thing that stands out that says this is why I do what I do. But I love the excitement that comes along with really providing exceptional care, really making sure that we are doing everything we can to get the patients in the door quickly, and provide the services that we are so lucky to have here in Peoria, for sure.
And if you are looking to self-refer or you need to even give information to your doctor, there's a website out there that you can search and find the OSF Cancer Institute. But for the number, you can call 844-OSF, the number 4, HOPE, 844-673-4467. And again, they do know. I know, like you said, I had a personal experience with a friend whose father had a diagnosis. She didn't know she was getting runarounds from other places. I gave her the number and she was shocked. It was within less than a day. She got the call back. She's like, thank you. There was a person. It was everything you said. There was a person and just got it started. And it was just reassuring.
Absolutely.
So Mandy Lukowiak, Sarah Ince, thank you so much for sharing the story of the rapid intake system at the Cancer Institute, and continued good luck with it, with an important part of the services we provide at OSF Healthcare.
Thank you for having us.
And thank you for joining us today. And if you want to see any of the OSF Healthcare Accelerated podcasts, all you have to do is go online to osfhealthcare.org/accelerated.